Welcome, everybody. I'm Craig Larson. I'm the Executive Director at the Chronic Disease Prevention Alliance of Canada, or CDPAC. I'll be moderating today's webinar. CDPAC is an alliance of Canada's major national health organizations sharing a common vision for an integrated system of research, surveillance, policies, and programs for the promotion of healthy living and the prevention of chronic diseases. To learn more about CDPAC, you can check out our website and connect with us on Twitter, Facebook, and YouTube channels listed at the bottom of this slide. Today's webinar, titled Food Insecurity Measurement in Canada, Interpreting the Statistics, is the first of a two-part series being co-hosted by CDPAC and Dr. Valerie Tarasic, the Principal Investigator of the Proof Project at the University of Toronto. Today's webinar is intended to bring together practitioners, policymakers, and other stakeholders in healthy living and chronic disease prevention to learn about the results of the Proof Project and to begin the dialogue on how you can put the evidence into action in your own jurisdiction and workplace. So thanks everyone for joining in. It's now my pleasure to introduce our first presenter, Dr. Valerie Tarasic, Professor at the University of Toronto and Principal Investigator of the Proof Project. After we hear from Dr. Tarasic, we'll hear from Suzanne Gilsloot, Public Health Nutrition Provincial Lead at Alberta Health Services, and then we'll hear from Tracy Woloshin, Public Health Nutritionist at York Region Public Health. Thanks everyone for your attention, and I'll pass it over to you, Val.
Hi, everyone, and thank you very much for tuning in today. We are delighted to be hosting this webinar, and I've got to tell you, we are absolutely ecstatic with the response to this initiative. So thank you all for coming. So this webinar is focused on food insecurity measurement in Canada, and our focus very specifically on this webinar is the issue of how to interpret the statistics. We're doing this for a very particular reason, as you'll see going forward. We're at a beautiful point in time where we have a huge amount of interest in food insecurity, which is fabulous because food insecurity is a very serious problem in Canada. And what you can see on this slide now is a potpourri of headlines that we've captured over the last couple of years. There's a lot of interest in what's going on here, and that's terrific. But we feel like with the burgeoning interest in food insecurity, there's a real importance that we get things right. So that's been the impetus for this webinar today. A lot of people who have taken up these statistics as the interest has burgeoned are people in the health sector. And it's wonderful that so many of you have tuned in today. The reason food insecurity is so important for people working in health is that it is a potent social determinant of health. What you can see is just a range of conditions that have been identified as being associated with food insecurity. The problems traverse the life cycle. And honestly, I can tell you as someone who's worked for a long time in this area as a researcher, just about every negative health condition we can think of is associated with food insecurity. So people in food insecure households are way more likely to experience it. That ranges from poor birth outcomes to children in food insecure situations being more likely to develop asthma or depression, on through to adults having a whole range of conditions and having much higher probability of not being able to manage those conditions well. The focus of my section of this presentation is to focus on getting the facts straight in terms of what exactly it is that we're counting when we look at food insecurity, the variable that's been associated with all those health problems. How many people in Canada are food insecure, and is this problem getting better or worse? To start with, I thought I should take you through a little bit of a history lesson on food insecurity. The public face of this problem in Canada is food banks, and it always has been. And in fact, we can thank food banks for drawing our attention to the problem. The first food bank appeared in 1981. And then over the next few years, we saw a proliferation of them. And with that, in 1989, the first issuance of a hunger count, so national statistics on the number of people using food banks. By 1997, Food Banks Canada started doing annual releases of hunger counts, reporting on the number of people using food banks. It wasn't until 1994, so well after food banks had become established, that we had the first question on a national survey asking about hunger. And it was a question about child hunger. After that, we had a decade of a whole assortment of indicator questions being asked on national surveys. And then in 2005, we started monitoring food insecurity in all sincerity. We came about this activity of measuring food insecurity on national surveys as a way to understand the phenomenon that was being witnessed on a day-to-day basis in communities in terms of people using food banks. Here you see the module that's been used on the Canadian Community Health Survey now since, well, initially 2004, but monitoring since 2005. It's an 18-item questionnaire that was developed by the United States Department of Agriculture. It was developed for monitoring food insecurity in that country. The questions range in severity from worrying about not having enough food through to compromising the quality of food, and then a whole bank of questions that are capturing people's experiences of quantitative deprivation. All of the questions have a clause attached to them to indicate that the deprivation that's being reported is anchored in a problem of not having enough money to buy food. That's because most Canadians get their food by buying it. And so we're trapping here the problem of people not being able to afford the food that they need. The questions about people's experiences of food compromise differentiate between adults and children. And that's because of a very disturbing body of research that has shown definitively that when families are struggling to cope with scarce resources, adults will deprive themselves of food as a way to free up what remains for their children. So it's quite I mean, the questions are awful questions. It's quite a heartbreaking thing for us to be monitoring like this. What exactly are we measuring? Well, the food insecurity module that we've got is measuring inadequate or insecure access to food due to financial constraints. What you see on this slide is the definition of food security. And that is a much, much broader notion of all people at all times with access to sufficient, safe, nutritious food that both meets their dietary needs and their food preferences. It's really, really important to get the thing that's being captured in that statistic that I showed you earlier, the 4 million, the statistics I'll talk about that are being captured in the monitoring in Canada. It's really important to recognize that we're not measuring food security. We're measuring a very particular thing called food insecurity, household food insecurity. And so when we talk about the problem, that's the problem. And Suzanne and Tracy will say more about this when they present. But to start with, it's really important to be clear on what it is we're seeing. The survey module used to monitor food insecurity in Canada is the Canadian Community Health Survey. This survey is run by Statistics Canada. It samples over a 2-year period, and the survey is huge. There are 130,000 respondents aged 12 years and older, and food insecurity is captured as part of the household demographic characteristics of those respondents. It's important to recognize that the Canadian Community Health Survey doesn't include people living on reserves, nor does it include people in some remote parts of the country, people on armed forces bases, or people who are literally homeless. The fact that we're omitting particularly First Nations communities and people who are homeless means that we are absolutely not capturing everybody who's at risk of food insecurity, even though the Canadian Community Health Survey is designed to be representative of more than 98% of the Canadian population. The food insecurity module itself is only mandatory on this survey on alternate cycles. So you can see on this slide that in 2007, 8, and 11, 12, we have national data on food insecurity. On the other years, the provinces and territories get to decide whether or not they measure food insecurity. And sadly, when given the option, there always seems to be some jurisdictions that opt out of measuring food insecurity. So when reporting statistics, the only nationally representative data we have are these two periods, 2007 and 8 and 11, 12. How do we capture food insecurity with those 18 questions? Well, we simply total them up and figure out how many times a person has said yes to those 18 questions. When the module was first introduced, Health Canada did an extensive examination of how that food insecurity module operated in Canada to make sure that it was appropriate for our population and that it scaled out people properly. And with that, they released a report that is an extensive discussion of the measurement. They identified 3 categories based on the responses to the 18 questions. And the food insecure were divided into moderate and severe food insecurity, depending on how many questions they said yes to. So that people who are severely food insecure are those that have said yes to so many questions that we have reason to believe there was quantitative deprivation. So the scaling is important. It's unique to Canada. The United States doesn't do things quite this way, but it's been very valuable in isolating distinct categories of deprivation. But you can see that the food secure category is based on people having said either no to everything on the questionnaire or saying yes to only one item on one of the modules. Looking at the data for 2011 and 12, we can see that 2.5% of households were classified as severely food insecure, and another 5.8% were identified as moderately food insecure. When we've looked, though, more closely at the food secure group, so that 91.7%, what we figured out is this, that 4.1% of households have actually said yes to something on the module. Not enough yeses to classify them as moderately food insecure, but nonetheless, they've indicated some problem with food insecurity. Looking more closely at the 2011-12 data, here you see the questions that those people in that marginally food insecure category answered. 45.5% said they worried about running out of food, and then others said they couldn't afford to eat balanced meals or the food they bought didn't last. So these are people reporting some level of deprivation that is not trivial. When we look at the relationship between marginal food insecurity and household income, there's a very, very clear gradient whereby the probability of being food insecure rises almost exponentially as income drops, which is what you'd expect, right? To not be able to afford to feed yourself and your children balanced meals because of a lack of money, it's most likely to be a problem that happens amongst people with lower incomes. Looking at the sociodemographic characteristics of households by food insecurity status, and looking particularly at the marginal group here, a very distinct pattern emerges. I'm showing you on this slide 4 characteristics that have been well known to be associated with higher probability of food insecurity. So being a renter rather than a homeowner, being on social assistance, being Aboriginal, or being in a family that is headed by a female lone parent. And what you can see is in each one of these cases, we've got a gradient whereby the marginally food insecure are more likely to bear that characteristic than the food secure, but less than the moderate. When we look at health data, we see a similar pattern. Here you're seeing data from a study that we did in Ontario looking at the healthcare costs associated with food insecurity. So the bars here are showing you the average dollars of healthcare used by adults in food insecure households in Ontario over the 12-month period when their food insecurity status was assessed. And what you can see again is that the marginally food insecure are distinct, right? They have a lower total healthcare utilization than moderate or severe. There's a clear gradient here, but a substantially higher healthcare utilization than the secure. Putting all these pieces together, we at Proof have proposed an expanded definition of household food insecurity. We suggest that it is important to not ignore those people who have answered yes to 1 or 2 items on the food insecurity module, not enough to be moderately food insecure, but still some indication of a problem, because it looks like those people truly are more vulnerable than others and shouldn't be grouped in with the food secure. Moving on to take a look at the numbers, totaling up the number of severely food insecure and moderately food insecure. And that gives us a total of about 1.1 million households in Canada being food insecure if we just count severe and moderate. When we add the marginally food insecure to the total, we jump up to over 1.6 million because we've got more than 500,000 Canadians in that marginally food insecure situation. If we look at the 2 cycles of CCHS for which we have nationally representative data, there's a profound increase in food insecurity. In 2007-8, 11.3% of households were food insecure. By 11-12, the number has risen to 12.4% of households. This is a highly significant difference. There is no debate here. The change in food insecurity between these 2 cycles of national data is a change that's going in very much the wrong direction. If we throw out the marginal and just look at the moderate and severely food insecure, there still is a substantial increase in food insecurity, and it's highly significant. So again, whether you count marginal or not, the moral of the story here is the problem's getting worse. If you looked at any of the infographics from Proof, you will recognize this one. This is some findings from the report that we issued on household food insecurity in 2012. And first, to draw your attention to the bars on the right-hand side of the screen, what we've done in this report is break up the years into individual years, so 2007, 8, 11, and 12. It's important, we think, because what we can see is that 2012 is higher than 2011. We also have generated this number 4 million, taking a look at the number of people living in food insecure households. We've done that, and many others have followed suit, recognizing that Canadians are more accustomed to thinking about problems at the level of the population or individuals than thinking in terms of households. So that 4 million resonates a bit more than the 1.7 million households. Two options for determining the number of people living in food insecure households. One option is to look at the number of respondents in CCHS who report living in food insecure households, and then apply person weights to get a population estimate of the total prevalence of people living in food insecure situations based on CCHS. The problem with that, though, is that CCHS does not capture people under the age of 12. The sample is only people 12 years of age and older. The other option, and this is the option that Proof is using, is to take data on the number of people in each one of those food insecure households and then apply household weights to get a population estimate. Now, for those of you who are not statistically inclined, I should just make the point that we're waiting because while the Canadian Community Health Survey is gigantic with a sample of 130,000, the survey weights are applied to prorate those 130,000 respondents to get something that is representative of the population in its totality. So the weighting is an important step, but how you apply the weights and to which pieces of data render very different estimates of the number of people in these situations. Here you see the results with the two methods for the two cycles of CCHS that we've got national data on. All persons and then the 12 years plus. And what you can see is what you'd expect, right? A profound difference in the head count. If we relied just on population weighted data for the respondents of CCHS, we end up with a very, very different impression of how big the problem is. Look at 2011 and 12. If we count everybody living in these households, we're at almost 4 million. If we count only those 12 years of age and older, we're at 3.2 roughly. Who are we missing? We're missing children under the age of 12, and that's a lot of people. Almost 800,000 by the time we look at 2011-12 data. Here's another graphic from the Proof report. We've gone further to take a look at the proportion of children overall, and this is now us counting children from the ages of 18 under. And what we found is that 1 in 6 Canadian children are in food insecure situations. So it's extremely important to work with the household demographic data to get a full impression of who's food insecure and where they live and what their circumstances are in Canada. Going backwards, I just want to make a brief comment about the relationship between food insecurity and food bank statistics. As I said earlier, food banks were the kind of the canary in the coal mine with this problem, and we still often see food bank statistics being reported as measures of food insecurity. This graph shows you the number of people living in food insecure households over the 4 years for which we have national data. Those are the orange cylinders. The green cylinders are the number of people who were reported by Food Banks Canada to be using food banks in March of each of those years. And what you can see is a very, very big difference in the magnitude here. To work with food bank statistics alone is to grossly understate the extent of the problem in our communities. Food bank statistics are also problematic when used as a way to talk about changes over time. To illustrate this point, I'm showing you a graph of food insecurity rates and food bank usage in the province of Newfoundland and Labrador. And I'm showing you that for a reason, because Newfoundland and Labrador in between 2007 and 2011 experienced a profound drop in food insecurity. So the rate went from almost 16% down to just slightly more than 10%, because at that time, the province had a very effective poverty reduction strategy going and food insecurity was dropping. But over that time, we don't see anything near like that kind of a drop in food bank usage. For all intents and purposes, food bank usage remained fairly stable. What it means is that looking at changes in food bank usage, while that can be very important for people operating food banks or wanting to understand just exactly how charity is being used in their communities, it's a very insensitive marker of changes in food bank or food insecurity rather in the community overall. Lastly, to talk about accessing data on household food insecurity. And in some ways, this is probably the most important part of this presentation. We realize that as the interest in food insecurity has grown, many organizations and agencies have started trying to find data on food insecurity prevalence at the local level. And food insecurity statistics are being reported in all kinds of reports, in the Vital Signs and the Canadian Index on Health and Well-being. There are all kinds of organizations now taking up these data. So it's worth talking about the data access issues a bit more in terms of what's available. At the top of this slide, you'll see microdata files. Those are the files that are the complete files on the responses and weights from the Canadian Community Health Survey. Statistics Canada uses those files for all of its reporting on food insecurity, but they're also files that are available to researchers who have access to the research data centers that are housed at many universities. With the microdata files, one has access to absolutely everything. So you can work with household weights and household composition data to create the head counts that Proof is doing. You're also capable of generating estimates of marginal food insecurity as well as moderate and severe. The share files are files available to the provincial and territorial governments, and we see those files being used by public health departments across the country to generate statistics at a local or health authority level. The share files also contain household weights, and they also enable users to estimate marginal food insecurity. So they have the makings of more fulsome estimates of food insecurity. Public use files on the Canadian Community Health Survey can also be downloaded online. So they're good for organizations and agencies that don't have access to these more restricted files, the microdata or the share files. But the public use files do not contain household weights. So there's no opportunity to generate robust estimates of the prevalence of household food insecurity at a local or regional level, nor can the public use files give you a head count of all the Canadians living in food insecure households. Lastly on this list are the CANSIM tables, and these are probably the most widely used statistics on food insecurity in Canada, but they're also the most limited. Here's what the screen looks like if you were to type in CanSim and food insecurity. This is what you'd see. A screen, you can easily get to tables that enable you to find prevalence estimates for food insecurity. And if you look in the middle of this slide, you can see that there's a row there that includes a word manipulate. It's a tiny word, but right in the middle there. With that manipulate button, you're able to generate estimates of food insecurity at the census metropolitan regions or provincial regions, whatever. But these CANSIM tables right now are very limited in that they only generate data for moderate and severe food insecurity, and they only provide head counts of the number of people who are affected from 12 years of age and older. They don't allow you to get the estimates of the full number of household members affected. So if you are using CANSIM tables, it's very important that when you write the sentence that says, here's the prevalence of food insecurity in our area, that you are clear that you're talking about people 12 years of age and older, and you're leaving out the marginal groups. So it's a limited set of data, but nonetheless important because of its accessibility. I'll stop there with one more slide. If you have been at all intrigued by anything about food insecurity enough to sign on to this webinar, I would encourage you to take a look at our website. And on that website, you'll find more information about the reports that we've issued over the last few years of access to CCHS data. You'll also see some fact sheets and some other resources related to research findings on food insecurity. I would also urge you, please, to tune into the second webinar where we plan on talking more about who is affected and what we've come to understand about the genesis of this problem in Canada. But for now, I'd like to turn things over to Suzanne Gaisley.
Thanks, Valerie. For the next portion of this webinar, I'm going to highlight some of the key ways that we have used Household Food Security Survey module data in Alberta Health Services, particularly within our roles in our nutrition services and our population and public health team. This first slide identifies activities within the monitoring and reporting function of public health in which we've been involved with. We've been greatly supported by leadership within the Alberta government, particularly Alberta Health, to choose household food insecurity as an optional model for the Canadian Community Health Cycle. So that means we've got coverage of food insecurity for the 2005, 2009 to 10, and 2013 to 2014 cycles, meaning that we have uninterrupted monitoring of household food insecurity in Alberta and can really look at how the situation progresses in our province. The most recent report we have provided is our Household Food Insecurity Backgrounder Report, which describes the relationship between income, health, and household food insecurity in Alberta. Like many reports, the consistent messaging we are communicating to our stakeholders in our backgrounder document are that household income is the strongest single predictor of household food insecurity, that household food insecurity represents a broad spectrum of challenges and is not interchangeable with the term hunger. We are also able to identify, as Valerie talked about, specific populations who experience household food insecurity at higher rates than the general public, so such as lone parent families headed by females, people with a disability, individuals on social assistance. And finally, that there are unique health consequences and considerations for household food insecurity. I also wanted to mention that a key contributor to the public health field has been this consistent monitoring of data available through the Household Food Security Survey module that's in the Canadian Community Health Survey. As Valerie also alluded to, prior to 2007, and I say 2007 because that's the year that Health Canada released Income-Related Household Food Insecurity in Canada report, and that was very significant to us in public health because it was the first time we really had a report that put together all the information about household food insecurity. Before that time, much of the data we relied on in public health was data such as food bank usage information, unemployment figures, social assistance rates, and so forth. While this is still very important data, one of our roles at the provincial and local levels has been to promote and use a household food insecurity prevalence and severity data to describe the situation rather than these other data sources. This next diagram I'm showing, and it's of the 4 domains of household food insecurity, we found has been very helpful in our public health work to describe, first of all, that the physical sensation of hunger and acquiring food through avenues such as food banks or emergency meal programs that are often referred to as the social domain of household food insecurity are not synonymous or interchangeable with the experience of household food insecurity. We found it helpful to explain that households that experience food insecurity endure a wide spectrum of challenges that range from that psychological area of persistent worrying or anxiety about running out of food to impacting the quality of food, and then at the quantity level, the experience of skipping meals to eating nothing for a day or longer. So this next slide, which is entitled Interpret and Apply, this one is to help illustrate that in terms of our public health interpretation and application of household food insecurity data, we have found that data providing information on both prevalence and severity of household food insecurity is critical to its application to health. The proof analysis of the data has been particularly important because they capture, as Valerie was talking about, the marginal or worry anxiety category, as well as the moderate and severe categories, which are, of course, have important health implications. It is also this range of severity, the marginal, moderate, and severe, that the full 18-item Household Food Security Survey module uniquely captures and cannot be determined from shorter tools, such as 1 to 2 item tools that we see a lot emerging in the literature. Also in Alberta Health Services, we have used the full 18-item tool to explore the prevalence of household food insecurity in clinical situations and to look at comparison of those prevalence rates to national and provincial prevalence data. Local research we did within a diabetes clinic revealed a total household food insecurity prevalence rate that was more than double that seen in the general population. And particularly concerning was the rate for severe food insecurity, which was greater than 5 times the Canadian and Alberta prevalence rates. We also emphasize with our communication to various stakeholder groups that household food insecurity is experienced differently between and within households. Where we often find this requires discussion or emphasis is when we are talking about children in the household. Although the hungry child is often portrayed as the face of household food insecurity, we know that within a household there is unique experiences of the situation within household members. In terms of public health policy and program planning, also in our slate of cost of eating in Alberta documents is our affordability of healthy eating document, which uses our Alberta nutritious food basket data along with living wage data to present the situation or analysis of whether households vulnerable to food insecurity in Alberta have adequate income to follow a nutritious diet. The household food insecurity data that are now available were the foundation for the development of the household profiles used in this report to portray the prevalences and experiences of food insecurity in Alberta. In addition, the categories, again, the marginal, moderate, and severe, enabled us to show how food insecurity is not a uniform experience between or within households. For example, we were able to show with those statistics, households led by lone parent mothers experience food insecurity at nearly 6 times the rate of 2-parent families or lone fathers. And we are also able to tie in health conditions and the health and food insecurity relationship into these profiles. Where this analysis led us to was a presentation of household food insecurity as a health equity issue. This gets back to the points raised earlier around the uniqueness of the measurement of food insecurity related to income. As an income inadequacy is clearly the issue impacting healthy eating in our household profiles. And also we are able to position policy actions situated in the realm of economic, health, and social policies that ensure all Albertans have enough money to meet their own nutrition needs, and to avoid conflation of household food insecurity with a broader discussion around the important concepts of community and global food security. Thank you for the opportunity to share our experiences with the application of this very important data into public health.
All right, this is Tracy Woloshin speaking. I'll be talking about program planning in public health using the Household Food Security Survey module data. As already discussed, the Household Food Security Survey module measures insecure or inadequate access to food due to financial constraints. And the results show, as has already been talked about, but the numbers of households experiencing income-related food insecurity is in the thousands, well, depending on your health unit size. So in my health unit here in York Region, our health unit epidemiologist used the data to estimate that over 24,000 households experience marginal, moderate, or severe food insecurity in our region. Again, as Valerie already discussed, these definitions, and they're not the opposite of each other. So, for example, increasing nutritious food for participants in a community food program would increase their food security according to this definition, but would not decrease their financial constraints or would not decrease their food insecurity. So when framing our programs, calling income-related actions food insecurity and food-related activities food security could be confusing because people might logically assume that increasing food security is decreasing food insecurity, thereby leading to conflation of our objectives. And this was clarified for us in Ontario at the 2014 conference of Public Health Dietitians in Ontario, when Dr. Lynn McIntyre cautioned us about conflating income-related food insecurity with the broader definition used for food security. And she suggested that the broad framing of the problem of food security is inhibiting progress on policies that might better address food insecurity and financial constraints. So when we program plan in public health, we have several important goals. There are more goals than on this list, but these goals could apply to community food programs that we support from public health. And all of these goals are important from a public health, nutrition, or healthy eating perspective, separate from expecting that they will impact on food insecurity. And when we use CCHS data and know that thousands of households in our area are food insecure, and that food programs don't have an impact on these numbers, we could look at how we frame our programs. So in order to avoid conflation of community food programs with food insecurity, would the framing of programs, as on the slide, reduce the confusion between food security and food insecurity? Here at York Region Public Health, we frame these programs around these important public health goals. For example, food literacy is one of the priority areas of our work in nutrition services. Another local example I thought I'd mention, in York Region, we have the Community Investment Strategy, which provides funding to community agencies that serve our residents. The wording under the community health result area used to say food security to refer to community kitchens and food reclamation programs, for example. But we've shifted that language from food security to framing these programs as focusing on healthy eating. With regard to the public health problem that is measured by the Household Food Security Survey module, a public health goal would be to increase incomes, to reduce economic barriers, and to reduce household food insecurity. So actions on this public health goal would be conducting food costing, which Suzanne talked about, and writing reports, which may include specific public policy recommendations, such as advocating for increases to social assistance rates and the minimum wage, and increases to affordable housing, and investigating the basic income guarantee or guaranteed annual income. Public health staff may also participate and collaborate with local basic income or poverty reduction groups to broaden advocacy efforts. And also, here in Ontario, the Ontario Society of Nutrition Professionals in Public Health has written a position statement that focuses on income-related food insecurity as an urgent human rights and social justice issue requiring an income response, such as the guaranteed annual income. Other public health examples are using the nutritious food basket data to monitor income sufficiency by applying the cost of the food basket plus the cost of housing to various individual and household incomes. This provides an indication of groups that are likely to experience financial constraints that would likely lead to household food insecurity. This slide shows 2015 and 2016 data from York Region for a single person on social assistance called Ontario Works here. And this graphic illustrates how housing and food costs alone, not counting all other living expenses, would already put this person in a deficit situation, illustrating financial constraints and, of course, a very high risk of food insecurity. This is the front page of the Ontario Society of Nutrition Professionals in Public Health position statement mentioned above. 15 of 36 health units in the province have endorsed the position statement, and public health staff use it and accompanying resources in their health units. For example, Using CCHS Household Food Security Survey module data, their nutritious food basket costing, and the OSNP-PH position statement, some health units develop tools such as this infographic to communicate their key messages. This infographic is from the Halliburton-Kawartha Pine Ridge Health Unit and points to the need for income responses to address food insecurity.
Thank you, presenters. That was great. Now I think we've got a number of questions and comments that have come in. And I'm going to start with, there's a few actually for Dr. Tarasik that are two different people, where they're both asking about Newfoundland. And so one of the questions is, does slide number 40, Newfoundland and Labrador, does it count food security in terms of marginal and severe? Another question in that area is, what was the poverty strategy that was effective in lowering household food insecurity in Newfoundland?
The red line on this slide is showing household food insecurity, including marginal, moderate, and severe. And what we are going to do with CDPAC after this webinar, on their website, we'll post both the webinar and some resources. When those resources get posted, one of the things that we'll include in them is a manuscript that we wrote, or that Rachel Loopster wrote, that was a very in-depth examination of what drove that drop in household food insecurity in Newfoundland and Labrador. And so they had a poverty reduction strategy, but among the things that Rachel figured out in her analysis of that red line was that about 40% of the decline observed here was the result of changes that Newfoundland and Labrador made to their social assistance programs that basically put more money in the hands of a very vulnerable group. But whoever has asked those questions, I thank you and urge you to sign up. Keep your eyes open for webinar number 2, because it's that kind of stuff that we want to develop more in the next webinar. But also when the resource page comes up, you'll be able to gain access to that manuscript to read the story of Newfoundland in more detail.
Thank you, Dr. Trusek. Another question I think is for you as well. Is there any movement happening that you're aware of towards capturing more of the marginal data in, for example, in the CanSIM?
Well, I'm trying my darndest to persuade people that the marginal category needs to be captured. I would encourage those of you who are on this webinar and who are researchers yourselves or people using the data, I would encourage you to report the marginal category and to consider it in your analyses of food insecurity data. I think the more of us who use the category, the more likely everyone is to get used to it. The other thing that certainly we're in the process of doing is writing some documents to try to encourage the shift at the federal level towards an inclusion of marginal. Obviously, when governments take on marginal food insecurity, the prevalence will go up because it'll add another 4 or 5% to the prevalence. But I think it needs to happen as more and more research comes in showing the vulnerability. So I'd encourage all of you who are data users to look for marginal and to use it where you can, and to talk about the importance of it.
Thank you. We have an interesting question from Lisa Liu. She says, we're thinking of initiating a program at our healthcare site to provide vouchers for dollars to spend at a produce market. The person would have to match that amount in dollars to be able to use this. So that would actually double their value to purchase produce. But do any of the panelists, do you have any ideas on how to keep this program sustainable? We want to empower people, not just act as a charity.
I would say, this is Tracy speaking, the sustainability is definitely going to be your problem as far as funding it. I'm thinking that perhaps framing it as a food systems measure, for example, to support the farmers market, which is a really good goal for us to have at the community level, working with our community partners such as farmers and farmers markets. I feel others can chime in, but I'm not sure about framing it around the wording of food security or food insecurity, because I'm just concerned about this issue of again, conflation and let's say policymakers in your area or provincially or federally thinking that that is actually going to be a response that's going to address this serious underlying problem that we have of income inadequacy.
It's Val here. I don't have anything to add there, Tracy, except to say that you said it beautifully. Thanks.
When we were looking at this question a couple of years ago in Alberta, we actually tried to look at, okay, what would it actually take for someone who is in a food insecure household to access a farmer's market? And that may be by transit and certain days of the week. So we actually had a couple of high school students take that endeavor on, and it took them 6 hours to go by transit and bus to actually go to that. So it's a bit of a different piece, but one piece is actually limited dollars overall in terms of accessing such a piece. Other factors which also are involved, or households who experience food insecurity also experience. And then, as Tracy said, and I don't want to pull away from that in my comments, is that the issue is of income to access food, and very other important community programs to support local food can sometimes be mixed up with that, with then mixed messages for our local agencies and program planners.
Great. Thanks to all three of you for your response on that one. I have a question now from Ellen Desjardins. I'm just asking Val if you could please discuss the validity of published articles related to household food insecurity that have not used the 18-item CCHS module, but typically a smaller set of questions. They may acknowledge this difference and not compare their data with the CCHS stats. Are these studies valid at all, or are they to be dismissed because they've not measured household food insecurity with the 18-item module? How do we deal with these studies?
Well, without knowing specifically what studies you're talking about, I would hate to say dismiss them. I think that the prevalence estimates really need to be derived, especially now that we have CCHS. We have an abundance of data. So I think we should be drawing prevalence estimates from the Canadian Community Health Survey. And the only exception I would make to that is if there are surveys of particular vulnerable populations that have not been captured by the sampling frame of the Canadian Community Health Survey. And by that, I'm referring to First Nations communities and people who are living on the street or in, without addresses. But still, I mean, presumably other published reports that have used smaller numbers of questions have done so with the intention of looking at food insecurity in relationship to other things. And I think there's a lot that we can learn from those kinds of research initiatives. So not to just throw out the baby with the bathwater, but when it comes to figuring out how many people have the problem, Statistics Canada and Health Canada have invested a lot in us getting very good data. And right now, despite the wrinkles in the lack of marginal data on the Canson files or whatever, despite the wrinkles that I've described in this presentation, I would say that we in Canada are in a luxurious position in terms of having extremely good prevalence data that's very robust, very sensitive, very good data, and we need to make use of it and discourage people from using smaller sets of questions as if they're measuring the same prevalence. I mean, one of the things to think about for those of you who aren't researchers is the number of questions. 18 questions. If we cast a bigger net, we catch more fish. And so if you ask 2 questions and you get a prevalence estimate, or you ask 18 questions and you get a prevalence estimate, you're going to be able to capture more people with the 18 just because it's a bigger net.
Thank you, Val. Mariel Munoz has a question for Tracy. She asks, could you please explain further the rationale behind reframing the community kitchen from food security to healthy eating as the goal? Would the community kitchen program not speak to the definition of food security?
Right. So that's exactly what I was grappling with in my section, was the fact that, as you've pointed out, the definition, or there are a few definitions of food security out there, and community food security, which also cast a very big net, different net, but conceptually a big net around what would be included if we use those definitions for food security or community food security. And in my work on food security in Ontario and public health, I've found that using those definitions, everything from discretionary fortification to sodium to farmers markets, it is included in those broader food security definitions. What I've been exposed to, through the scholars from Proof and, Dr. McIntyre's presentation is this concern about taking the focus, the much needed focus off income inadequacy. And there's a real concern that we are doing really more harm than good when we call everything food security. And I mean, that is the tradition I come from, but the concern is that people will feel that the food insecurity is being addressed because we're working on what we're calling food security. So, for example, a community food program. So even from a program planning, accuracy and program planning perspective, I'm sort of posing on this webinar. What about framing food programs as valid, important nutrition promotion programs? But if it's food literacy, so be it. If it's the food system, like the farmers market example earlier, so be it. But staying away from food security or food insecurity language and framing when it's a community food program that may be reaching, 10 people or 100 or 1,000, but, nothing like the numbers we have for food insecurity, and definitely not addressing this extremely important public health problem, health promotion problem, health inequity problem of inadequate income. And we know that it is, I don't know if seductive is the right word, but, it's appealing to want to be creative, and people want to get on board food programs because there are benefits from them and they feel good, and we all want to eat, and we all love our, promoting vegetables and fruit. I do promote them as well. But in terms of this issue that we're looking at today, I just feel that calling community food programs anything related to food security is going to derail us from keeping our focus on the income inadequacy problem.
We have a question now from Heidi. Why would food insecurity as defined today not be called barriers to food access? As a food security activist, I think it is asking a lot for the public to think of insecurity as something other than the opposite of security.
I think it's asking a lot too. That's why I don't feel that we should use food security, even though we do have these definitions around that are about the broader definition. I'd prefer, I'm wondering if we can stay away from asking, as you say, asking people to think that food security is the opposite of food insecurity.
All right, thank you. Now, Pat V. has a comment to share. Since this is a webinar about measurement, Dietitians of Canada emphasized this in recommendation number 3. It's all about how to measure, including marginal and using household food insecurity as a marker in poverty reduction. And we should think about using that recommendation. So thank you, Pat, for that. Daniela has a question for Tracy. Tracy, you touched on the relationship between food security and food insecurity, and how food security has more components than just food insecurity. Can you touch on other examples of food security or expand on this concept?
The perspective from food security that we have used traditionally, historically in public health is a very expanded concept. And, healthy food for an active life for all people at all times is a pretty broad brush conceptually. So it really becomes everything to do with anything food related and nutrition related and healthy eating related. So it becomes this sort of amorphous concept. And I think that when we program plan at the local level, if we're using CCHS Household Food Security Survey module data, and if our aim is to reduce these horrific numbers of people who are struggling terribly, terribly for something that really should be a basic right for everyone in the world, and for sure in a country like Canada, if we're concerned about this problem of food insecurity, I think we need to keep our focus clear, and that's why I'm wondering if at the local level, when we're program planning, if we can be specific when we use CCHS and when we're talking about food insecurity. And if we're, like I say, if we're working in the community with our partners and, you know, with our colleagues in our public health units, we can work on vegetable and fruit promotion by all means. It's a very important public health goal. It's a very important part of our mandate. But for this issue, I think we need to keep our eye on the problem.
Can I just add something? It's Val speaking. I just want to give an illustration of where some of the confusion concerning to us with respect to the measurement of food insecurity. There are examples, many examples now in the public domain of, I think, very well-meaning organizations and agencies where someone will talk about the number 4 million, you know, this huge problem of food insecurity in Canada. And in the next breath, we'll talk about it as a problem of people lacking access to nutritious, culturally appropriate food. And there are many people in Canada who I'm sure lack access to nutritious, culturally appropriate food through reasons of income. But the conditions that are being captured on this household food insecurity module, the conditions that we're monitoring in Canada and we're reporting through these statistics are actually much more serious. They're way worse than somebody not being able to get culturally appropriate food. We're talking about people not having enough to eat at all. The extremity of the conditions being captured here, I think, is partly what's driven us to want to emphasize that when you're talking about the problem or using the statistics, as we truly want people to do, it's really important to not kind of dilute them into being a measure of everything. That they're a measure of a very, very serious problem, but it's not a measure that is appropriately captured by this broader language of food security.
Thank you. Tanya Malcolm notes that they're in the middle of creating a food recovery program. Perhaps all three of the speakers would be interested in commenting on food recovery programs. Is it possible to link a recovery program to income support?
I think that with income support, the issue is that people need more income. And if we're, if we're looking at a food program, it's another alternative food system like, food banks, and it's not getting at the root of the problem. And is it potentially and perhaps implying that the root of the problem is being addressed because there's this program in place?
Thank you for that. Vanessa asked, what steps need to be taken to capture food security among children under 12 years old?
I think the very simple step is that we need to get the CanSIM files that are available online, the reports that come out from public agencies. We need everybody to be capturing the household composition data that are readily available in the Canadian Community Health Survey, so that when we identify a household that's food insecure, it's very simple, trust me, for people who have access to the data to simply scroll along and see who's living in that household. How many children are there under the age of 6? How many are under the age of 1? How many are teenagers? And so that information exists. We don't need more measurement, but what we need is, I think, a bit of a paradigm shift in terms of the reporting of this information, so that we don't see this continued reporting of individuals 12 years of age and older. It is already totally possible with the available data to get more elaborate measures. I mean, most recently, we've been looking at households containing newborns, and we've been able to do that by using data from the Canadian Community Health Survey. It's a really important direction to go in because, infants and young children are so vulnerable, but the information is all sitting in the Canadian Community Health Survey. It's just about getting health units and governments to start to be more deliberate about the reporting of the whole household composition as opposed to just this weighted value of respondents.
Thanks, Val. Now, Rim Fayad says that in New Brunswick, they're trying to capture a proxy for food insecurity among students in the Student Wellness Survey, G6 to 12. which is a big sample size that enables them to use the data at the local level. The question is about how often do you go to bed or school hungry because there's not enough food in the home. So that's a comment to share. Does anybody want to respond to that?
What worries me about those questions is that they're so extreme. And I mean, our work looking at the Canadian Community Health Survey suggests that we have about 1 in 6 children under the age of 18 living in food insecure households in Canada. How directly we need to know their experiences to know those children are vulnerable, I think is a debate. Whether they go to bed hungry or whether they go to school without gym shoes because their family can't afford them, whether they have to scrimp on birthday gifts or whether they don't get to put jam on their toast or their mother has to ration what she serves sometimes for meals as she gets near the end of the month. I mean, all of those things are tragic circumstances for Canadian children to be in. So I would discourage trying to measure directly such extreme conditions because I think you can only go in one direction. You will get a very big underestimate of the extent of the problem in the area. And to what end? I mean, it's stigmatizing to ask these questions, and so we need to be careful when we do. But I'd urge you to think about other ways, perhaps, to use the existing data so that you're not having to probe so deeply into such a hurtful thing with children. You can only get an underestimate from doing so. And I question whether you really need it for the next steps in whatever you're doing. But perhaps you could follow up with me by email if you'd like to carry on this conversation more. Thanks.
Thank you, Val. Jennifer Atkins asks, or comments, thank you for highlighting the overuse of food security in community health centers. It gives a false illusion that loads of food insecurity work is being done by the community health sector, yet we're missing the mark. Thank you, Jennifer, for that comment. Joan Stonehawker says that food security has always been a difficult concept for the public to grasp. Now it seems clear that it confuses our ability, or what is needed, to address food insecurity. Do you have a suggestion or a new shorthand language that means food insecurity reduction?
Joan, I think if you look at the opening slide for this webinar with just a few highlights of what we've been able to see in the public press, I think what we're seeing is the adoption of the language of food insecurity. I can't get over the number of times that I hear other people using that phrase now and that I see it in the media. So I think we're there. I don't think we need another phrase. It's certainly not for public communication. I think there's an increasingly, stunningly wide acceptance of the use of the term food insecurity. I think the trick is just for those of us who are speaking on this issue or reporting on this issue in some way to make sure that we always talk about the definition of the, we always use the term correctly. As I say correctly, meaning in relation to the thing that we're actually measuring. And that we go back to kind of Tracy's way of thinking in terms of talking about the roots of the problem as well. But I think the horse is out of the barn. I'd agree food insecurity was never a good term. And if anybody can't see that, just think about all the confusion in this webinar around our use of security and insecurity. I mean, it's crazy to be arguing that something isn't the opposite of something else. But the horse is out of the barn. The term is being used very, very widely in the public domain now. And so I think it's just our job to follow suit and make sure that we use it consistently.
Craig Orrell has a question here. Could you please clarify? In one of Val's slides, it said that the people who indicated one positive response were considered food secure. But then later you said that selecting one or two indicators was categorized as marginal food insecurity. Does this mean that in the CCHS, if people responded positively to one indicator, they would have been considered food secure? And are you saying in your data, you actually counted them as marginally food insecure?
Yes, that's exactly what we're saying. So, but the importance of the distinction is that if you look at the reports on food insecurity statistics that have come out of Statistics Canada or Health Canada, or if you look at many of the reports that are coming out of public health units, what you're seeing is only moderate and severe food insecurity being reported. So the people who only say yes to one question are being treated as if they said yes to none and that they're food secure. And so what I did in this webinar was try to illustrate the extent to which we have a group, I mean, more than 500,000 households who are struggling at some level, and that level does correlate with negative health outcomes. So we need to be thinking about them. But the most important, I guess, takeaway, it sounds like you've got it, is that that group exists. And when you're looking at reports on food insecurity, it's important to think about, are they being counted as food secure or insecure? And where do they belong?
Thank you. Becky Thomas has a question for Val that the 2014 Food Security Proof Report states 3.2 million as the number of food insecure Canadians. But she notices the 4 million stat from the 2012 report is still being used widely on the Proof website and elsewhere. Which is the more up-to-date number, she asks?
Thanks very much for that question. I appreciate the opportunity to clarify that. That in 2013 and 2014, when food insecurity was measured, there were 4 jurisdictions that chose not to measure. So that's British Columbia, Newfoundland and Labrador, Manitoba, and Yukon. So there are 4 jurisdictions that are not in there. So if you look more closely at the reporting from Proof in the reports on 2013 and 14, we are saying that of the jurisdictions who were measured, 3.2 million Canadians were identified in those jurisdictions as having been food insecure or having been in a household that was food insecure. But nationally, we should not be using 3.2 million. We should be using the 4 million because our national data from 2011 and 12 are coming in at 4 million. For us to talk 3.2 million, we're pretending that Newfoundland and Labrador, British Columbia, Manitoba, and the Yukon have zero food insecurity. And we know they will have rates of food insecurity somewhere above 10%. Sadly, that the Yukon is very likely to have a rate of food insecurity closer to 20%. So we can't use the numbers from 2013 and 14 as if they're nationally representative and treat it as 3.2. Our most up-to-date estimate nationally is the 2011 and 12 CCHS. So if you're lucky to live in a province like Suzanne, where in Alberta they've had consistent monitoring, they're able to talk about the situation in Alberta consistently. And for them, their most up-to-date number absolutely is 2014. But nationally, we have to keep ourselves anchored in 2012 until we get more national data, and that number is 4 million.
Thank you, Val. Sarah Nunn has a comment and a question. I'm not sure if you're able to answer it, but she says the farmers market, or she observes quite clearly that farmers markets and local foods are really very expensive. So when we know that poverty is directly linked to food insecurity, should we be encouraging this? Does anybody want to comment on that?
Maybe I can comment, and it's just, overarching comments around that is local farmers markets, local agriculture, sustainable food systems are just undoubtedly important to community and for other public health goals. However, I think we, again, in talking about food insecurity, we're wanting to realize that policies and programs that promote local agriculture do not make it easier for low-income populations to afford a healthy diet. And so again, coming back to that the issue is a lack of adequate income to purchase enough nutritious food, regardless of where it originates. And maybe just I'll add on to that is, again, there's very little research around the cost of nutritious foods at farmers markets. And I think the little information that we have and the anecdotal information would actually support the comment that Sarah is making, that those food sources we cannot assume automatically would be less expensive choices than what is available in the market system.
That was great, Suzanne. I'll just throw in too that this discussion brings up another slippery point, which is the whole cost of food issue. And when we do our nutritious food basket costing, for example, we always have to be so clear about pointing out that it's not the cost of food that's the problem. For the average income family in Ontario, they spend a very low percentage of their income on food. And the argument is made, and this isn't my area of expertise, but our food supply in Canada is actually considered affordable. And again, it's just because we've marginalized people so much that we have this horrific problem on our hands. So even talking about the cost of food and the cost of food compared to this grocery store, that grocery store, or a farmer's market, that's almost, not sure, it's almost like another discussion.
Thanks, Susan and Tracy, for that. Josh asks about, does the CCHS have a person weight variable in addition to a household weight variable? And if so, can the household weight variable be used to get whole population measures, i.e. including those less than 12 years old, for other public health issues like obesity, physical activity, and sleep, etc.?
Depending on your access to CCHS, if you're using the share files or the microdata files, you will have access to both household weights and person weights. But no, you wouldn't want to use those weights to get a whole population estimate of something like obesity, because the children under the age of 12, their obesity wouldn't have been measured, right? Their body weight wouldn't be measured. The reason we can get household composition data and get the total number of Canadians living in food insecure households is because we've got a measure of the condition at a household level, and then we're just extrapolating to say everyone in that household was exposed to something. Well, how food insecure the individuals are, we don't know, but we can say that, this is a household that's severely food insecure, and it contains 5 people, 3 of whom are under the age of 6. And so that's an important thing for us to be able to know. So depending on your access, yes, you can have both weights, but you need to think through what the variables are that you're interested in as to whether you can apply the household weights.
Thanks, Val. Elsie Azevedo Perry is asking, Tracy, you've been using the word conflation a few times. Do you mind to just clarify that again, please?
As I understand it, conflation is confusing objectives so that they kind of get muddled, so that we sort of slip around with our objectives. So we'll say that we're addressing a certain issue, and then we slip over to another issue. So we conflate income inadequacy with, for example, food desert problem, like people don't have access because they live in an area that doesn't have grocery stores with vegetables and fruit, and that gets slipped into an objective that's income like another objective.
Now, we've got a comment and question from Arlene Moore. She notes that adults sacrifice food for their children often. And when the Canadian survey is weighted, does the weighting capture that some children do not go hungry because adults are the ones going hungry instead?
Well, in the statistics that I've reported in this webinar and in the things that we're reporting in the proof reports, we're not talking about individual people going hungry. Household food insecurity is a household level condition. And that's the way that that's the way those 18 items on that module are intended to operate. So if we wanted to know, has somebody gone hungry, we'd need to ask them. And then, and we'd have to say how often and all that kind of thing. In those 18 questions, there are questions that say, are there times when adults in the household or children in the household have gone hungry without eating because of a lack of food or money for food? And if yes, how often has that happened over the last 12 months? So that those experiences are captured, and a person could, if they wanted to, do an examination of just the responses to those individual questions. The problem comes when you've got more than one adult or more than one child in the household, and you don't know exactly whose experience it was. But I think what we've learned from looking at other correlates of food insecurity, the sociodemographic characteristics, the health characteristics, the health risks associated with being in a household that's food insecure, it seems, and this is something we'll get into more in the next webinar that we do, but it seems like just by virtue of being exposed to household food insecurity, people are at risk, whether they personally will report that they have gone hungry or not. So that's why we keep ourselves at a household level.
Thank you, Val. Now, let me just start by saying I wanted to thank very much our presenters, Valerie Taratsik at University of Toronto and Suzanne Gale-Sloot at Alberta Health Services and Tracy Woloshin at York Region Public Health for sharing their work and knowledge with us today. And as I mentioned, that CDPAC will be co-hosting a second proof webinar with Dr. Taratsik. And in that webinar, we're going to focus on what drives vulnerability to household food insecurity in Canada, drawing on analyses of the wealth of population data that have now accumulated from over a decade of food insecurity monitoring. We'll examine the social and economic circumstances of food insecure households, review the evidence on household level risk factors for food insecurity, such as food skills and health status, and we'll look at what has been found to underpin changes in food insecurity prevalence rates over time. And we'll certainly talk about the implications of these findings for policy and practice. So a special thanks to all of you in the audience for your attention, your questions. We're so glad you could join us today. Thank you, everybody, and goodbye for now.